Hi. Let's learn about Form 1095-B, Health Coverage. Form 1095-B is an Internal Revenue Service form that may be sent to taxpayers who receive minimum essential health insurance coverage as defined by the Affordable Care Act, ACA. A 1095-B form shows information such as the health insurance coverage, effective coverage dates, individuals covered, and the coverage provider. Form 1095-B, Health Coverage contains healthcare coverage information for taxpayers, their spouse, and their dependents if they were enrolled through an insurance provider or a self-insured employer. Most health insurance plans provided by an employer will typically qualify as minimum essential coverage, and other qualifying plans include government-sponsored programs, like Medicare and most Medicaid plans. Under the original rules of the ACA, taxpayers were required to have minimum essential health insurance coverage for each month of the year or have a coverage exemption. If not, a penalty called a shared responsibility payment might have applied. However, this penalty was eliminated as part of the Tax Cuts and Jobs Act. In addition, the IRS acknowledged that the provider's obligation to supply 1095-B forms is not an enforcement priority, as long as providers comply with specific conditions. Some U.S. states have implemented their own penalties for those who do not have health insurance coverage for the entire tax year. Taxpayers should check with their state and local governments to determine if there is a penalty for not having minimum essential health insurance coverage throughout the tax year. Health insurance providers send Form 1095-B to individuals for whom they provide minimum essential coverage. Form 1095-B provides information about who was covered and when. Taxpayers receive Form 1095-A if they enrolled in a qualified health plan via the health insurance marketplace, and if health insurance was received from an employer with 50 or more employees, they may receive Form 1095-C. Depending on who provided your health insurance coverage, you should have received either Form 1095-A, Form 1095-B, or Form 1095-C. You usually have to provide information from these forms or acknowledge receiving one of them on your federal tax return. You do not have to submit the form itself. All pages of Form 1095-B are available on the IRS website. IRS Form 1095-B is sent to taxpayers who receive minimum essential health insurance coverage as defined by the Affordable Care Act, showing health insurance coverage, the insurance provider, coverage dates, and individuals covered. Taxpayers do not need to send the 1095-B form to the IRS. Instead, you indicate on your tax return information provided from 1095-B, such as how many months you had health insurance coverage during the tax year. Form 1095-B is sent to individuals from health insurance providers indicating whether the taxpayer had minimum essential coverage. Form 1095-C might be sent, with or instead of 1095-B, if you had health insurance coverage from an employer with 50 or more employees. Here are 3 key takeaways. 1. Form 1095-B, Health Coverage contains healthcare coverage information for taxpayers, their spouses, and dependents if enrolled through an insurance provider. 2. Under the Affordable Care Act, ACA, minimum essential coverage is required as part of the individual mandate for health insurance. 3. Recipients of Form 1095-B don't have to send it to the IRS, instead, check off a box on their tax returns, indicating the months they had health insurance coverage during the tax year. Hope this would help. Thanks for watching.